chaired in a session by Professor Bhavanani and my own mother, Amaji. Before I start, I will invoke the ancient rishis led by Patanjali who have given us this wonderful teaching of yoga. Yogena chittasya padena vacham malam sharirasya cha vaidhyakena yo bhagarotam pravaram muninam Patanjalim pranjalivanatosmi Patanjalim pranjalivanatosmi Om. This afternoon I am going to be talking about the role of yoga in prevention and management of lifestyle disorders. Lifestyle disorders are naturally going to be occurring because of improper lifestyle. So when we already know the cause, why is it that we are not able to prevent, manage or stop them, though we know the answer? And the very simple answer is because all of us are too lazy to change. And that is the biggest struggle we in yoga have. We have a center here in Sri Balayogi Vidyapith, the Center for Yoga Therapy, Education and Research, where our primary focus is on salutogenesis. Everybody has heard about pathogenesis. What are the causative aspects of disease? But we are looking at what are the causative aspects that can help us to be healthy. Salutary from Latin and Greek, health and genesis, what are the causes? So our center has been given the mandate by our management here, as well as the visionary administrators, Seduraman sir and AK sir, that we need to look at what are the factors that enable us to be healthy, how can we apply them for ourselves, our patients, as well as all the medical, paramedical professionals coming out of this university. We are looking at not just the patients, but also our students. And here, along with the patient care, which is the therapy aspect, 38,000 patients have received benefits of yoga therapy. We have courses going from certificate to diploma, MPhil yoga therapy, and now this year PhD in yoga therapy. But along with that, the most important aspect is that all the MBBS students of this university, all the dental students and all the nursing students are receiving training in yoga as part of their curriculum. This is something path-breaking, this is something very innovative. Now, if you look at the top 5 causes of death worldwide, we all know that cardiovascular, respiratory, cancer, diabetes and stroke are leading the way. And all of these conditions ultimately are a disassociation of the mind and the body, where the mind is not listening to the body anymore and the body is not listening to the mind anymore, what are called stress-induced psychosomatic disorders. Now the psychosomatic disorders have a long history in our Indian tradition, that 5,000 years ago itself, sage Vashishta, the Vashishta Rishi, he teaches Lord Rama about Adija Vyadi, Anadija Vyadi. Those disorders due to the Adi, the psychosomatic, and Anadi, those which are not due to the psyche, the non-psychosomatic disorders. So this is the tradition that we are taking forward here. Modern culture, if you can call it culture at all, leads to the modern diseases because of autonomic dysfunction, bacterial overgrowth, overnutrition, other conditions leading to metabolic inflammation. I always wonder about it because we talk about modern culture, but I wonder whether there's any culturing anymore, because culture means growth, culture means life, culture means sustenance. And what we see is more of death, decay, deterioration happening today. The lifestyle disorders caused by stress, sedentary habits, overeating, untimely food and odd hours of work I think the medical professionals are the worst in this. We advise everybody about healthy lifestyle, but as a medical student, I often said we never got up to do Surya Namaskar. We stayed awake the whole night studying, did Surya Namaskar to the rising sun and then went to sleep. So we always had it upside down. And if you want to know where the unhealthy food is, most of the time it is the medical institutions, unhealthy lifestyle, the medical professionals and medical students. So we know what we should do. But as Duryodhana tells Krishna in the Mahabharata, I know what is right, I cannot bring myself to do it. I know what is wrong, I cannot stop myself from doing it. And then he blames Krishna, saying, Krishna, you are the eternal self that lives in everyone. So you are in everyone, everything. You must be in me. So if I am like this, it is all your fault. The fault finding committees that we all know exist so much. Now, everybody is only focusing on this part, the manifest part, where we have the diabetes, the heart disease, anxiety, hormonal imbalances, cancer, you name it, it's up there. But we are forgetting there is a huge amount of stuff lying beneath. And this is where I must remind all of us that Thiruvalluvar in our Thirukural, the wonderful Tamil Veda, he tells us, Noi Nadi, Noi Mudal Nadi, Adu Tanikum Vai Nadi Vai Pache. You have to look at not just the disease, what is the root cause of the disease, find the treatment and apply it. Patanjali tells us, Heya Hetu Hana Upaya. The same principle is given in both the Yoga Sutras of Patanjali as well as the Thirukural. So, if you look at all of this, we find poor digestion, genetics, trauma, toxic thoughts. How many of us want others to be happy? How many of us want others to succeed? How many of us want anybody else to succeed for that matter? In dog-eat-dog races, what's happened? Even if you are the top dog, you are still a dog. If you still win that rat race, you are still a rat, you are not yet a human. And yet we have all these negativities in us. We are constantly abounded in negativities. We are swimming in negativities, and yet we think we can be healthy. How can your body be healthy when your mind is filled with negativities? So these toxic thoughts are an important aspect. We really don't know what to do about it in most systems. In yoga, we are trying to address it by the concept of Chitta Vritti Nirodha. Stop these unconscious, subconscious negativities that are whirlpools that are dragging you down to the depths of despair. Similarly, lack of exercise, nutrient deficiencies, poor relationships. See, if you don't like yourself, how are you going to like anybody else? If you cannot live with yourself, how can you live with anybody else? And this is where we are not at ease with ourselves. The root of all disease is us not being at ease with ourselves. When you move away from that ease, that sukham, you move into dis-ease or dukkham. And this is where the choice lies within us. Am I going to adopt an attitude of ease or an attitude of dis-ease? Today's society is being eaten up by a cancer of disease, of duality. You are different than me. You belong to a different religion, a different culture, a different nationality, a different color, creed, gender. We keep on finding differences, and then we all feel we are lonely. You have killed everybody off because they are different than you, and then you complain you are lonely. I think we need to start going back to our culture that says Vasudeva Kudumbakam, Yadu More Yavaram Kere, is what our Tamil culture says. Vasudeva Kudumbakam. The whole world is one family, not just human beings. All living beings are one family. Jiva Karunya principle of Vallala, not too far from Pondicherry. When we have these attitudes, automatically relationships, toxic thoughts go down, and then you can definitely sleep because you are not worried about somebody else getting promoted over you. You are not worried that somebody's H index or I index is better than yours. And you are not worried about your salary not yet getting credited on the 10th of the month. The toxins, poor diet, stress, inflammation, these are again aspects where we are looking at it from the point of view of yoga. Now a very good algorithm is given to us saying health and good lifestyle choices. This is the green part. Now the moment you start to go into poor lifestyle, you have disease, medication, which may or may not control it. And if you continue the poor lifestyle, you go from green to yellow to red, worsening disease, more medication, uncontrollable disease, finally death. So most of the time our patients, all of us, are at this point that we are sort of controlling our disease. We are not really curing it. So we have the choice, by making a good lifestyle choice, we can go back to health, rather than make the wrong choice and go on to worse conditioning and death. The chronic diseases, we know the risky actions, and we still continue them. The Duryodhana complex I told you. Risk factors, the same issue, leading to the chronic diseases. So the interaction between the risky actions that we are definitely able to modify, the risk factors which also most of the time we can modify them. There are just a few things you cannot modify. You cannot modify your parents, you cannot modify your age, you cannot, well, some people are even modifying the gender. So there are not too many non-modifiable factors anymore. We can modify a lot. And people say, oh, genetics. I must remind them that my professor of medicine, Dr. A.K. Das at JIPMA, he was very popular for making a statement. He said, your genetics is like a loaded gun. Whether the gun goes off or not depends on you pulling the trigger. If you pull the trigger, it goes off. If you don't pull it, it doesn't go off. And genetics, especially now with epigenetics and those changes that are happening, I think we need to understand the non-modifiable factors are not such a big issue. The modifiable ones are there, but we need to have the courage to change ourselves, the conviction to take it forward and make the changes. And that is where I would like to focus on yoga as a way of life, not a mere exercise. That places great importance on the proper and healthy lifestyle, including achar, healthy physical activities and exercise, which are the right thoughts and right attitude. Ahar, healthy nourishing diet, sattvic diet, vihar, proper recreation, and of course vyavahar, healthy interpersonal relationships. All these 5 components are part of yoga as a lifestyle. And yoga can be said to be the best lifestyle ever designed for humankind. We know it. It belongs to our culture. But we need somebody to come from USA, certify it, and then maybe it will become popular. Up to the time Narendra Modi ji went to the UN and said, let's have a yoga day, yogis and yoga didn't have the status they have today. Suddenly the whole equation has changed. Because now there is a political mandate to it. Do we require a political mandate to change our attitude towards health? Aren't we responsible for our own health and happiness? And if we are responsible for our health and happiness, why don't we do healthy things and happy things? We want to do, as my father would say, unhappy things and be happy, unhealthy things and be healthy. If you want to be healthy, do healthy things. If you want to be happy, do happy things. Yoga gives us the Ashtanga, the 8 limbs, that start with the Yama Niyama. These are the basic principles of being human. How can you be a good human being? Ahimsa, Satya, Asteya, Aparigraha and Brahmacharya, giving us the Yama, the control over the lower subhuman tendencies, and the Niyama, Saucha, Santosha, Tapaswadhyaya, Ishvara Pranidhana, enabling us to manifest our humaneness. Reduce the subhuman, manifest the humane. Pranayama and the asanas to enable us to have a steady, flexible, healthy body and understand the flow of energy happening through the prana. Starting to control our mind, take the senses inside, focus the mind in pratyahara and dharana, and then finally dhyana and samadhi where we can have that flow or absorptive oneness. The Yama Niyama enable us to have social health. The WHO tells us health has to have the physical, it has to have the mental, it has to have the social and even the spiritual components. The physical components, you can say the asana pranayama. The Yama Niyama for the social component, the dharana dhyana for the mental and the samadhi going up to the spiritual. So the social component, physical, mental and spiritual, all of these components can be given to us by the all-round lifestyle of yoga itself. Some useful yogic principles: psychological reconditioning, developing appropriate attitudes, stress management through different techniques, normalizing the metabolic activity, and relaxation visualization to induce a sense of inner calmness and well-being. See, the only time you can heal is when you are relaxed. If you are tense, you cannot heal. If you keep on saying, I want to get better, I want to get better, I want to get better, you will never get better. You have to let go. When you let go, you can start to get better. And that is the power of letting go, relaxation. One of the greatest gifts that yoga can give us. Advantages of yoga, well, one, preventive, promotive, rehabilitative, and I put a question mark over curative because we are not too sure about that. Science, philosophy, art, involving body, mind, spirit. And here, unlike most of our pharmaceutical drugs, we have positive side benefits. You do yoga because you have a migraine and you find you can sleep better. You do yoga because you have diabetes and you find your blood pressure is getting controlled better. So the side benefits are there. Simultaneous improvement in general health. And I think it is very apt for me to say here that there is reduced medication giving better compliance. Because as a practicing physician, I used to always find patients stop taking medication for two major reasons. One was the side effects and second was the cost. These are the two principal reasons a common person stops taking medication. The side effects or the cost. Now what happens? The moment you add yoga as an adjunct therapy, along with the modern medical management, you are able to reduce the dosage required. And we all know, you just have to reduce the dosage a little bit and so many of the side effects don't happen anymore. 1 point. The moment you reduce the dosage or the number of drugs, the cost factor goes down. Side effects have gone down, cost factor has gone down, the patient feels better, they are going to be more compliant with that therapy module than just giving them one drug plus 2 plus 3 plus 4 plus 5. And this is where yoga as integrative medicine being practiced here at Sri Balaji Vidyapith, where patients, along with the regular allopathic medicine in psychiatry, in medicine, in gynecology, in neurosurgery, they get the yoga also. And the most important component, relief from stress, that I had mentioned earlier. The yogic concept in the Yoga Vashishta is that the stress leading to the mental agitations as the adi leads to the diseases down at the bottom. So stress leading to disease, adi leading to vyadi. Now we all know this. Once upon a time it was very useful to have a stress response. Because you were walking along the road one day and suddenly a saber-toothed tiger came, you had to save yourself. And you started bouncing away and running like that little man on the screen. But however, today what's happening? You don't have saber-toothed tigers, but you still have this fight or flight response going on. Whenever you get up in the morning and you look at your partner in the bed, you see a big saber-toothed tiger. You come out, you go and get into your car and you start driving on the road and there are so many saber-toothed tigers on scooters and cycles and rickshaws and cars. You get to your workplace, there's a huge saber-toothed tiger called your boss. Or if you are the boss, your subordinate. Huh? And then what happens? You keep on finding saber-toothed tigers everywhere. Because we have perceived everyone around us as different than us. Dichotomy, duality as the first disease. They are different, so they are a threat, unknown stranger. And then of course I tell our medical students, freeze, which often happens in stress response, especially during Viva. You know everything until you come to the Viva, and then they say, what's your name? And you're like, even name goes out. Well, that's an important psychological aspect of the stress response we face a lot. Now, we all know the stress response, the HPA axis and sympathetic arousal and all that. Where does it start? Perceived stimulus. And I would like to harp on this point a little bit because this perception of stress is actually where the whole response starts. And if you don't perceive something as stressful, the stress response is not evoked. So the key here is our perception of stress. And here, this model of salutogenesis tells us when there is a stressor, we can make a choice to use it positively towards salutogenesis, or we make a choice not to do what we need to do and go down that path of pathogenesis. So whether you have salutogenesis or pathogenesis is again a choice we make whenever a stressor happens. Recently, Dr. Selvamurthy, a former director or controller of DRDO, he was telling us how yoga enables us to modify the perception of the stressor, optimize the response, and release the pent-up stress. He talked about it as a 3-in-1 action of yoga with regard to the stress response. And this is where yoga comes in, because stress affecting the nervous, endocrine, immune system leading to disease, and yoga working the other way towards health. So this is where yoga can be said to be a vaccine against stress before it comes, and once it comes, I say it's an antidote. This is where we bring the yoga in. And again, all of it perceived stress. Once the perceived stress comes in, the responses come, allostatic load and diseases. So the key, if we can learn not to perceive things as being stressful, the change in attitude is one of the key aspects of yoga as a lifestyle. Now, some of you may have seen this. I use this a lot. Here there's a rhinoceros making some nice paintings. And he is the Picasso of the rhinoceros family. And in every painting he has this huge horn. Can you see that huge horn in every painting? Now you know what my question is, what is our horn? Any answers? The ego. Our ego is the horn that is in everything we perceive. Whatever we perceive through our ego, and our ego is the cause where the stress starts. Somebody tries to advise us something, and the first thing is, who are you to advise me? Don't you know who I am? I am senior to you, I am bigger than you, I am taller than you, I am more qualified than you, my pay scale is 10,000 more than yours. What happens? Our ego. The first question in Pondicherry when the police stop anyone who is driving rashly, the first question is, don't you know who I am? It happens all over our country. Pata nahi, main ko, main kaun hai? Then the question comes because the ego is so big. And that is why I must remind you, offense is usually not given, offense is taken. We say he took offense, we never say he gave offense. And where does that taking offense come? From the ego. The moment you think somebody is saying something because they don't like you, it doesn't matter what they say, your stress response kicks in. And this is where our perception is where we are working in yoga. This is what Strater and colleagues has also come to. They are talking about the correcting the underactivity of the parasympathetic nervous system and the GABA systems through stimulation of vagal nerves and reduction in allostatic load. These are mechanisms that are now coming up for this. And they are given also some very nice mechanisms by Ines, again talking about the one pathway where decreased perceived stress leading to decreased HPA axis sympathetic activity as opposed to enhanced parasympathetic, leading to all the benefits that we are finding in reducing the risk of atherosclerosis, hypertension and cardiovascular disease. So it's all boiling down to basically how we are able to manage the stress that is omnipresent in our lives. Similar mechanisms for diabetes have been given, and another mechanism that then came up was talking about how also the neurochemical systems, positive changes in neurotransmitter, neuroendocrine function, how they are also bringing about the same type of changes. Ultimately, the changes are coming from our decision to do something about it, as seen in the mental stabilization that is brought about because this inner correspondence and peaceful harmony. I told you about being at ease with yourself. If you are at ease with yourself, you are going to be more mentally stable. Mindful acceptance. You have decided to accept your limitations. You understand your own SWOT analysis. What are my strengths? What are my weaknesses? What are my opportunities and threats? When you understand yourself, you start to have mental stabilization. Automatically, the life satisfaction, quality of life goes up. We have worked at many studies in JIPMA as well as at Mahatma Gandhi here with the different pranayamas, finding these type of mechanisms. So in the lifestyle disorders of which for us the cardiovascular and diabetes are the primary ones we get to see, we find tremendous improvement from the patients, both clinically as well as the qualitative aspects. They feel better. And ultimately, at the end of the day, we want to feel better. We want to have that sense that I am well. It doesn't matter if my blood pressure is high or low, my blood sugar is high or low. I want to feel that I am well. Because otherwise the patient goes to the doctor and the doctor says your blood tests are normal, your blood pressure is normal, all your parameters are normal. And the patient says, but doctor, I don't feel normal. And then what do? We say, okay, go and see the psychiatrist. Because we cannot understand, they want to feel well. So this feeling well is a very important component that we are working on. And that is why I came upon this 10-point yogic plan, because everybody likes these 10-point plans, 5-point plans and things like that. One is the yogic counseling to develop awareness. We spend about 45 minutes with our patients talking to them about what they are having, listening to them, letting them understand and develop a perspective. Cultivation of appropriate attitudes, healthy heart-friendly diet is what we are looking at. Breath-body coordination practices to bring the mind-body together. The yogasanas with modification as per the individual ability. Pranayamas to balance energy flows. Kriyas to cleanse toxins, because Indian systems of medicine understand that the toxins clog up the system leading to disease. So Mala Shuddhi is a very important component along with Nadi Shuddhi. And then of course Mana Shuddhi is even more important for the mind. Mudras to reset the neural mechanisms such as the baroveflex sensitivity, yogic relaxation and visualization for self-healing, and dharana dhyana for inner vision. So many practices are there, but what I would like to stress on before I end today is an integrated approach. The need of the modern age is to have such an integrated approach. The yoga therapy can be utilized in coordination and collaboration with other systems such as allopathy, Ayurveda, Siddha and naturopathy. Physiotherapy, osteopathy and chiropractic can be used, but advice on diet and lifestyle is very important. Yoga therapy without advice on lifestyle is not yoga therapy, is how I look at it. Adoption of the right attitudes through yogic counseling. And again, I would like to stress that since 2010, this integration is happening at Sri Balaji Vidyapeeth. The ancient art and science of yoga has so many possibilities to help us resolve our issues. But we want it to be a miracle pill that we take once, an immediate solution to all problems. Sir, cannot you teach me one pranayama or one asana and I should be perfectly normal? Well, I wish. I tell people I am a musician, not a magician, to have that happen. It's a holistic science and must be learned and practiced in the wholesomeness. And when we work on it as a way of life, definitely we can work on the psychosomatic stress related, induced by stress, aggravated by stress, precipitated by stress. All those disorders we can definitely work on them, because the individual is empowered. The individual is given the power of health and happiness in their own hands. And this integration of yoga with modern medicine can help create a healthier and happier world for sure. Just to remind you once again, eating better, thinking better, feeling good, regular exercise, well, this becomes not just the cycle, but a spiral, a positive spiral of health towards salutogenesis. That is the goal that yoga gives us. The tools are given by yoga, but it's up to us to make it manifest. Health and happiness are your birthright, my father used to say, and do not forsake them for the plastic playthings of the modern world. He said this in the 60s, now it's even more true. Live and learn and live yoga, for then you will know the health and happiness. With his message, giving a big thank you to all of you for the time given, the attention given to this.